This talk is a carryover tradition from when Dr. Mullenauer used to be the advisor. And one of the things that she was trying to do with this workshop is to tell people about graduate school options, tell them how they should prepare for these things, and tell them how they should apply for graduate school. In addition, some information about the careers that are associated with these graduate school options. So it's a really big overview. It's something that in Psych 201 it takes me a semester to do. So you can imagine what's going to happen. We're going to have a lot of information that's going to be condensed into a small amount of time. I have slightly different objectives for our workshop. I just want to share with you what those objectives are. The one thing is I want you to, if you're here because you're interested in graduate school, so I want you ultimately to get into graduate school. That's our goal. In order to do that, I think we have to understand what's out there and why one option may be more appropriate for you than another. So there will be an overview, a rehash of some of the general information about graduate school options. I also want you to have the tools necessary. So we'll be talking about the application process as well today. And in addition, I want to make sure that you got it, right? And so at the end, when we do question and answers, feel free to ask about stuff that was on the slides or wasn't. Anything, like I said, we want to make this a good experience for you. So let me tell you, in terms of trying to cover all this information, we're going to do a bunch of things today. We're going to talk about graduate school career paths, educational paths to graduate school. In other words, how is it that you get to the end goal specifically? We're going to talk about clinical doctoral options, master's in research, master's hand-on options, time to completion. So we're going to talk about finances, the application process, the numbers, admissions, criteria. I think we had a question about that earlier. And then I'm going to provide for you some additional resources. I'm going to make this stuff available to you on our website afterwards, and in addition on this CD. And so what you'll find is that the PowerPoint slides will be available, and they have a bunch of links to information in there. Keep that in mind. Also, I list books, resources that I think that you'll find important, or relevant anyway. So keep that in mind as well. Let's go through talking about what these career options are, because I know that people are here for different reasons. I know that people are here because most people have some sense of what the ultimate goal is for a psychology student, right? And share with me what some of your goals are in terms of your options, the place you want to be, in other words. What do you think you want to do?
No.
How about the work you want to do?
Social work.
Social work? What about the work you want to do? What does that mean to you?
Help the community.
Okay, you want to help people in the community. Other people agree with that? What's your name?
Shaddai.
Say it again.
Shaddai.
Shaddai?
Yeah.
Okay, Shaddai. How about something different from that, completely different from that? You've got a different sort of career goal in mind, right?
Yeah, I was planning to go on for my MSW, but I'm a double major, so this is just going to be waiting for my other major to be finished too.
Okay. Well, share with me what you think your work's going to be when you're out there. What are your daily activities going to be?
I would love to work in an institutional setting with patients who need help with finances and getting the right health care.
So helping people as well, right? But yours is like helping in the community. Yours is like helping people with, and then you listed some very specific things. Okay. Still helping people though, I imagine. I'm sorry, I heard. Something different, yeah.
I want to work in virtual reality therapy, helping treat patients' phobias.
Helping people by treating their phobias. Okay? These are the kind of answers I'm looking for. What's your career goal?
I want to go into neuroscience, so help people by figuring out their behaviors by what's wrong in their brain.
Specific people?
Alzheimer's, drugs and behaviors.
Specific individuals? Helping specific individuals?
Yeah.
Practitioner. I'm going to keep that in mind in a sec. What about you?
I want to do consulting work in the business world, so in IO,
Okay, you want to consult. In other words, you want to help. Your client would be organizations, businesses, to do what?
Preferably I'd go in for a month or two and just figure out what they need to do to streamline their business, make themselves more profitable, et
Make
cetera.
themselves more profitable, do things, organizing the people that are involved in that business. Okay.
Correct.
Common theme here, right, is helping people, right, but in very different ways. Is there anyone here who, I mean, not to say that you don't want to help people, but you want to learn things? Yeah, describe it.
Yeah, I mean, helping is nice, but I don't want to help, I don't want the interaction of helping people on an individual basis for various reasons. I prefer the research to find underlying causes for others to use to help.
Okay, good. You want to help the people who are helping?
Yes.
Okay.
I don't want to hear about myself.
Neither do I. Okay, so what we've got here is actually a pretty good map of what I see in psych majors, which is most of us become psych majors because we've got that common goal, right? We want to help people. But the way we conceptualize it is different. We've got in the business world, 2 people over here. We've got in the community, we've got one-on-one by providing therapy or by doing assessment, helping people figure out what's wrong with them, or by helping them to build the knowledge base that all these people rely on to do their job. Okay, so what that represents is 2 tracks. And everything we talk about from here on is going to be structured in that way. We've got the hands-on, and that's the helping that we were talking about, with people, helping them, even the business stuff, in the community, with therapy, by doing assessment. That's hands-on. On the other hand, we've got the academic route, and that's the research. I mean, it's really easy. It's either research or it isn't. It's a way you should think about this. Okay. And to give you an example of the kind of degrees we're going to be talking about that are here in this area, we've got MFT, MSW, becoming a licensed clinical social worker. That's not an exhaustive list, but that's just some examples of what we're going to be talking about in there. We've also got, on the academic route, the PhD, and I've listed a Master's of Science in there as well. But the emphasis here is research, okay? Becoming the person who builds that knowledge base. Now what you'll see that I focus on in this talk is about the training that's involved in these programs, not necessarily what somebody does with their training. Remember to keep that in mind. And I'm probably a good example, right? I do academic counseling. I never thought that I was going to be helping people. I kind of had a statement like yours. I'm not sure I want to hear people's problems because it makes me uncomfortable. And I'm not really good at that anyway. But I went for a research career in social psychology, and I learned about human behavior, and I learned about research, and I learned about academics and the academic world, and I found that I had a passion not for helping people with depression or that, but for helping students achieve their career goals. And so I end up in academia, but in a specific kind of job. So remember, I got trained as a social psychologist, but I'm doing something somewhat different. I am still doing my research, but I'm doing something different with my degree. Now, were there some of you who felt that when you were listening to all this, both of those things sounded really good, right? You thought, I want to help people. We've had this conversation before. I want to help people. I want to, be hands-on. But you know what? Being the innovator, being the person who's providing that knowledge base sounds pretty cool too. And one person is like that, another person. Okay, you were just being shy. Well, we do have an option for you, and the quickest way to talk about it is to say that what you should keep in mind is that the clinical psych PhD is what you should be thinking about. If that's you, if that's truly you, if you feel like you're passionate about both of those things, this is what you should be looking out for. I'll talk about some alternatives as we get a little bit further along in the workshop as well. So let's focus for a sec on this academic route. Okay? The academic route is about, if we want to understand the basic underlying principle here, studying behavior and answering questions. Okay, so the training involved in degrees that are in the academic route are focused on teaching you how to study behavior and answer questions about behavior. On the other hand, the emphasis on the hands-on training is on counseling, testing, helping. In other words, applying the knowledge. Applying it in a hands-on way. You can see why the first category, or the second category here, is the more inclusive. It's either, like I said, it's either research or it's everything else. Everything that involves applying psychological knowledge, human behavior. Now, here are some terms that you'll want to know when we begin to really delve into these degrees. Helping profession training degrees and research training degrees. That's how you should think about these, okay? Because that's what they are focused on training you to do. And within this rubric of helping profession training degrees, we have what's called terminal master's degrees. Terminal because the notion is they end. They train you to do something. After you're trained, you're expected to then go on and practice whatever it was they trained you to do. Okay? We also have doctoral level professional degrees in this block here. So there are doctoral degrees that are focused on training. Again, training you in a doctoral level way, not in a master's level way. I don't know exactly what that difference would mean, but ostensibly at a higher level to do the work, to be a professional, to make assessments, to provide therapy, to do other stuff like that, okay? On the other hand, we've got the research training degrees. And here's another term you'll need to keep in mind, predoctoral master's degrees. These are research training degrees. They train you, again, to learn how, or they teach you how to study human behavior and how to use the research skills, how to use research skills, how to use the scientific method. They don't train you to apply that in a sort of hands-on way. They train you to be researchers. They're called predoctoral because they're supposed to help you be competitive for doctoral programs. It's the pre part where the emphasis is on that. And so consequently, the other type of degree we have here are the doctoral level research degrees, PhD. That's what we're talking about. Okay. One thing that makes all of this confusing is that some degrees can be both. Okay, and so when we talk about some particular degrees out there, you'll see that I will say they have dual purpose, or they are both terminal and predoctoral, or something like that. And if you think about this perspective, if you kind of focus on the fact that we're talking about the training that's in there, it's easy to understand what a dual purpose degree would entail, both research and some sort of training. Keep in mind that the applied masters that we have at San Diego State is one of these. So I'll tell you about that when we get there in a little bit. You can expect at a basic level, of course, the PhD trains you to be a researcher. And at some level, a professor. Okay? Now, PhD programs definitely train you to do the research. And they may or may not teach you the ins and outs of being a professor. I think there's a basic implicit notion that if you're in an academic environment and you're learning from your mentors, that all the rest of the stuff about being a professor just should come naturally to you. And sometimes that includes teaching. And some of you I know have told me in the past that you know that's not true. Just because someone has a PhD doesn't mean they were ever told how to teach. Right? But some PhD programs will focus on training you how to be a professor and the teaching and the professional issues involved with the professorate, and some won't. They'll just assume that you'll pick it up as you go. And here's an important distinction to remember about the PhDs. And it's that we have more or less a set of traditional sub-disciplines. Now, they don't represent the application of the work. They represent the area of research. Right? So if you're going for a PhD in developmental psychology, you are not learning how to work with children. You're learning to do research that's focused on the developmental process. And this is important. This may seem like a big duh to most of you when we're talking about social, developmental, cognitive, stuff like that, right? But when you come down to some of these here, like counseling and social work, it's really important because if it is a PhD program, again, it's training you to be a researcher, not to apply things that are related to social work, not to apply things that are related to, well, here's an exception. So when I talked about the clinical psychology having both the research and the practitioner piece of it, so does counseling. So does counseling. Here's another good example, school psychology. Again, there is a practitioner-oriented degree associated with that at the master's level. But if we're talking about a PhD in school psychology, we're talking about being a researcher, being an academic. And that means something very different. A practitioner of school psychology likely works in a school setting, right? Doing what school psychologists do, which, just for your information, is mostly assessment of students' needs, both cognitive and emotional. But it's mostly assessment and program creation for them. On the other hand, a school psychologist with a PhD is likely to be employed at a university doing research on this. Maybe they have ties to the school system because that's where they do their research, but they most likely are employed in this setting, this or a research setting. Along those lines, forensic, along with things like sports psychology and other types of psychology that you've heard of, represent not necessarily areas of research, but more broad areas of interest with, again, specific areas of research associated with them. And what you're more likely to see, does anyone have an interest in forensic psychology in this room, a little bit? What you're more likely to see, although they do exist, PhD programs in forensic psychology are PhD programs in some other classical, traditional area, like social or clinical or counseling, where the research that the people in that program do has a forensic emphasis on it, or it's got a forensic tone to it, or somehow forensic. And that's even more difficult to conceptualize because forensic psychology could mean a number of different things, as well as sports psychology. Forensic psychology could be understanding how it is that juries interact with one another to come to a decision about guilty or not guilty, right? That's forensic psychology. It could mean understanding what the pressures are associated with being incarcerated and how you take someone who's, let's say, assume for a second that they're not a violent criminal, maybe just somebody who was incarcerated because they lied about stock or something, like Martha Stewart. What are the pressures associated with being incarcerated, and how does that person deal with those, and how can you as a practitioner help that person deal with what's going on while they're incarcerated? That can be forensic psychology as well, but I think the one most people think of is understanding criminal behavior, right? That's what most people think, and that's one of the many ways that you can be a forensic psychologist. So what you may see is that there are people out there who call themselves forensic psychologists, but whose work varies. For example, a guy who does the kind of research I mentioned, or does the type of counseling that I was referring to, or somebody who's an expert witness in the criminal system, whose job is to determine whether someone is sound for trial or not. A lot of different things. Same thing goes for sports psych. I mean, it could mean different things. So if you're interested in looking for sports psych programs, you need to do a little more research about what you mean by sports psych, not necessarily what is out there. Now, clinical psych PhDs are everything that regular non-clinical psych PhDs are, right? They train you to be a researcher and or a professor, with this addition, and or a therapist, okay? So it's everything that's included in the PhD plus the practitioner side. There's a term that you should be really familiar with if clinical psychology is something of interest to you, and that's that they adhere to a specific model called the scientist-practitioner model. It'll come up in another slide as well. But that means that you are trained to be both a scientist and a practitioner of the science that you're learning. And the science even has a specific emphasis, right? It's clinical psychology. It's not the science of social psychology and to be a practitioner. It's clinical science practitioner. But you need to keep in mind that the emphasis here, because it is a PhD program, is still on research. So if you think that you want to be the next Dr. Phil, who, by the way, has a clinical psych PhD, but you have no interest in research, maybe you have no skills when it comes to research, that's another possibility, or you just don't think that that's something you want to focus on, especially in graduate school, which could take a certain number of years, then this is something you have to contend with, okay? In order to get into these programs, you've got to demonstrate to these admissions committees that you're already good at it, that you enjoy it, that you want to continue to do it. They're not interested in training practitioners only. They're interested in training scientist practitioners. So you have to play up the scientist part. And actually, there's a reason why it goes in that order. Scientist practitioner and not practitioner scientist. Because the emphasis, again, like I said, is on the scientist, not the practitioner. But there are other clinical options for you, not just the clinical psych PhD. I have referenced here an article, and actually, in my time here, I read all the stuff that comes out of the teaching of psych and careers in psych, and I found that Psy.Di's website does a really good job of just condensing a lot of information into a nice. So you'll see me refer to several web pages that are on Psy.Di's website that help us understand some of this material. The Department of Education typically are the departments who have counseling psych PhD programs. Now, if you think about what they are, what the definition of these programs is, clinical implies clinical, right, diagnosis, clinical diagnosis, being able to give someone some sort of, well, whatever it is a clinical means, right? Counseling is not so much focused on that, but focused on the act of counseling. So if you think about that, you can see how they might be different. Clinical psychology is focused on these problems. Counseling psychology is focused on the act of helping people with problems. You can also understand how they might be very similar, given that their interests are really closely related to one another. And so what we've done here is kind of compare them side by side. Clinical psych PhD versus counseling psych PhD. So let me just go over some of this information for you very quickly, right? What we have noticed, and you'll see it in this article, is that most people will say that they are actually more alike than they are different. They've got more overlap than not. And here are some of those similarities. For example, it's the exact same process to get to psychological licensure, either as a clinical psych PhD or a counseling psych PhD. They apply to the exact same psychology internships. They end up doing a lot of the same professional activities. In other words, being professors, doing research, practitioners, supervising, teaching, all of that stuff. They end up doing a lot of the same things. There are a couple of differences in the programs, however. For one, they tend to vary in size, location, and more specifically, in location, by that I mean departments of psychology versus departments of education. Competitiveness. And this one's important to keep in mind. While they are very, very similar, more people apply to clinical psych PhD programs. They have significant amount more applications. And because of that, clinical psych, well, and not just because of that, but partly due to that, clinical psych PhD programs are more competitive than counseling psych PhD programs. They have a slightly different theoretical orientation as well, where you see that clinical psych programs tend to focus, at least in their therapy, on this cognitive behavioral model, and counseling programs tend to focus more on a humanistic approach to understanding human behavior. And there is some small differences in employment settings. Mainly that you tend to see that people with the counseling psych PhD are more likely to be working in university counseling versus hospital settings. Okay? And there is a kind of a logical reason for understanding that. If you think counseling psych PhD programs are traditionally derived from or born of educational programs, they've got that sort of underlying theme associated with them. And so that's where they tend to be focused on student populations. Again, these are generalizations, and there are always exceptions, but if you want to understand what some of the difference between these things are, these are them. It's timely for me to talk about this degree here, even though it's not a research degree, just so that those of you who are clinically inclined can make reference to this option. So we want to talk about this as well. The Psy.D, which is not research. It's the Doctor of Psychology. Psy.Ds do a lot of the same things that clinical psych and counseling psych PhDs do, with varying differences. A lot more assessment. They do clinical practice, and they mostly work in health settings. There's no research focus, or there's a little research focus in Psy.D programs, and so what you see is that they don't typically teach at universities. They don't typically get jobs in research because they weren't trained that way. They were trained to be the practitioners of this information and to be good practitioners of this information at a doctoral level. You see that their admission requirements are indeed similar to counseling PhDs, but even less competitive than the counseling PhDs. Again, part of that comes down to a numbers game. They accept more people. They tend to take in more people than PhD programs do. And so if they're taking in more people, they don't have to have that cutoff. So they have got really good students in there, but they also have some students who maybe didn't get into other programs as well. Here's some, again, from a Psy.Chi article, some understandings of the differences between these two programs, right? If you think about the the theoretical orientation of the PhDs, it is, like I said before, scientist-practitioner model of education. Right? This is counseling and clinical psych PhDs. The Vail model refers to the Psy.D, and this is where the Psy.D was conceptualized at a meeting in Vail, Colorado. But they're trained as scholar professionals. So they put an emphasis on scholar, not scientist. Okay? And that's an important distinction because it's about understanding the field, understanding human behavior, understanding the research, but not necessarily performing the research. Their theoretical orientation, cognitive behavioral, in terms of the therapy that they're trained to do, versus you see a lot more psychodynamic approach to therapy in Psy.D programs. Again, generalizations, rules of thumb, there are exceptions in there, but this is, if you want to compare them, this is what you tend to see. The average acceptance rate for PhD programs, between 11 and 15% of the applications that come through. Average acceptance rate for Psy.Ds is more liberal, right? 40 to 41%.